For your information, the program will be streamed live on YouTube. The link will be given in the chat box. Let's all start with a short prayer for the war-affected population of Ukraine. In today's webinar, we are honoring Dr. Sherry M. Joseph, a CKK member, for getting elected as IDA Kerala State Vice President. So without much delay, let's move on with our today's program. I invite President IDA Central Kerala Kottayam, Dr. Manoj Thomas, to deliver the welcome speech and presidential address.
Thank you, Dr. Ashish. Good evening, all. Actually, I am traveling. Traveling ആണ് അതുകൊണ്ടാണ് ചെറിയ ഡിസ്റ്റർബൻസ് ഉണ്ടാവും. എങ്കിലും ഞാൻ CD കയറിയിരിക്കുകയാണ്. എല്ലാവരെയും നമ്മുടെ ഐഡിയ CKKയുടെ രണ്ടാമത്തെ വെബിനാറിലേക്ക് ഹാർദവമായി സ്വാഗതം ചെയ്യുന്നു. Today we are going to learn to make brighter smiles from our very own expert, Jos Thomas sir. He is a very eminent speaker on this topic, and he has taken a lot of speeches on this topic, and I think we are lucky to have him as our speaker for today. And I think after this webinar, we will be able to implement teeth whitening to our routine practice and can increase our expertise and our income through this process. And today, as you all know, we are happy and privileged to have our own Kerala State IDA Vice President, our own Sherry M. Joseph, as our guest. And he got elected in the last election as the State Vice President. As you all know, Sherry M. Joseph was one of the very active members and past president of IDA CKK. And we are proud to have him on this platform as our guest. And today, our CD chairman Ashish has done a very good job. He has worked very hard for promoting this CD and bringing this much participants to this program. This hard work and dedication. I welcome you all to this second webinar of IDA CKK. Thank you. Over to Ashish.
Thank you, Dr. Manoj. Today we are honored with the presence of IDA Kerala State Vice President, our own member, Dr. Sherry M. Joseph. Dr. Sherry M. Joseph, Central Kerala's Sherry Chayan, has been an active member of IDA since 1994, soon after his graduation. He is a state executive member since 1999 and served as Secretary of IDA Central Kerala from the year 2002 to 2004 and bagged state runner-up award for the best local branch secretary. He served as the president of IDA Central Kerala Kottayam in the year 2008 and bagged both national and state award for the best local branch president. He served as chief coordinator for many state programs like Kerala State Dentist Day of 2011, IDA State Inter-Branch Cricket Tournament of 2018, major COVID vaccination drive at Kottayam in 2021. He was the coordinator for the free denture program Pratyasha for the year 2014, for which he bagged National Appreciation Award. He served as the State Award Committee Chairman for the year 2016. He served as the Director of IDA Mark, the online dental store of Indian IDA Kerala State. Our Sherry Chayan, apart from IDA, has served in key positions in organizations like JC, Wiseman, etc. ഞങ്ങളുടെ സ്വകാര്യ അഹങ്കാരമായ IDA സെൻട്രൽ കേരളയുടെ സ്വകാര്യ അഹങ്കാരമായ ഞങ്ങളുടെ ഷെറി ചായനെ നമ്മുടെ ഇടയിലേക്ക് ഞാൻ ക്ഷണിക്കുകയാണ് നമ്മളോട് രണ്ട് വാക്ക് പറയാനായിട്ട്. ഡോക്ടർ ഷെറി. ഡോക്ടർ ഷെറി. Dr. Sherry, Pala branch in the installation period busy and Tonu. Namaka Sherry Doctor Kakamo. Fine, Namka move on Gialole. Dr. Manoj.
Definitely. We can proceed with the CD.
Okay,
fine.
Fine.
Can do that.
Fine. Later on. Okay. So, coming to the speaker, in a few minutes from now, we will start the lecture on bleaching, the teeth whitening simplified by Dr. Josh Thomas, an endodontist and a very renowned speaker in varied topic. Dr. Josh Thomas graduated from University of Kerala in the year 2006 and completed his post-graduation in conservative dentistry and endodontics from Calicut University in the year 2010. He works as a consultant endodontist and aesthetic dentist in several clinics in North Kerala. His own clinic, Metropolis in Kozhikode, is a referral center for advanced dental care. He is a national level speaker who conducts many workshops and CD throughout India. He is official speaker for Tokiyama, Japan, Ultradent USA, mentor and trainer for Protaper Dentsply India and Cetrodont. He conducts workshops on porcelain laminate veneers, teeth whitening, aesthetic dentistry, composite restorations, basic and advanced endodontics, and rubber dam isolation. His area of interest are microaesthetics and characterizations in composite restoration, microscopic endodontics, endodontic retreatment, bioceramics, and porcelain laminate veneers. I welcome Dr. Josh Thomas to his much awaiting audience.
Thank you, Dr. Ashish. Thank you. Shall we start now?
Yeah, sure, doctor. We can.
So welcome one and all, welcome all the members from IDA Central Kottayam and members from all the IDAs around Kerala. I think there are few members outside your branch also. So welcome to you all. So straight away, let's go on to the topic for today and how teeth whitening is important in your daily practice. So you can consider teeth whitening in several different aspects, but I would like to highlight the aspect where you can use teeth whitening as a stepping stone to develop your aesthetic dentistry. Or if you are already into aesthetic dentistry, if you're passionate about it, you're practicing aesthetic dentistry, bleaching or teeth whitening might help you to take your practice to the next level, or take your result of your cosmetic treatment to the next level. So aesthetic dentistry can use teeth whitening as a form of means to grow actually. So we'll discuss it. So coming back to teeth whitening, let me start with something very simple. Always remember, there should not be any cluttering in a clinician's mind. Always remember that there are two types of bleaching. One is office bleaching, the other is home bleaching. Office bleaching is when the doctor performs the bleaching procedure in the dental chair, and home bleaching is when the patient goes to his or her home and does the bleaching procedure. Now, what are the indications of bleaching? One is when patient is not satisfied with the appearance of a smile. This is what most people usually expect when we speak about bleaching, that a patient will come to your clinic and tell you that the patient is not happy with his or her smile. Then you would suggest bleaching, or sometimes the patient might ask for bleaching. So that should form only a very small part of your clientele. Actually, bleaching is something which you can promote to the patient. You can tell the patient that you can do bleaching along with this treatment so that the final result is much more better. So as a part of your cosmetic treatment, to enhance the result, you can use teeth whitening. And also metal-free, when a metal-free restoration is planned, like a metal-free crown, porcelain laminate veneer, or a composite restoration is planned on a discolored tooth. The old way was you would do your endodontic treatment, then you would do a crown or a restoration with an increase in thickness of the opaquer. So that is a very primitive and a wrong method to do. The best method is to correct the tooth discoloration, and then plan for a beautiful aesthetic restoration part. Now, for example, how to induce a patient, or how to tempt a patient to do an orthodontic bleaching procedure. Now, suppose you are doing an orthodontic treatment, and by the end of the treatment, let's say the patient has come for a final appointment, and this is what the patient sees. Now, what you can do is, you can actually do a single procedure, a single step of bleaching on the same day. Now, once you have debonded, again, this is what the patient sees. Now, after your oral prophylaxis is complete, you can give a tray to the patient, which is already ready, which doesn't need to be customized. We'll discuss that procedure later, that technique later. But you can give the tray to the patient, ask the patient to put on the tray and be on the waiting room for half an hour to 45 minutes. Then once it is over, this is what the patient sees next. And now this is not a full-blown bleaching or anything. It is just a simple teeth whitening procedure, probably 1/10th or 1/15th of what you can do. And usually the patients are impressed by this, because in a photograph it might not look very dramatic, but clinically it is very nice, because the teeth suddenly appear a little more brighter, and the teeth appear very clean, and so there is a sudden transformation. Now, if you compare it with orthodontic treatment, what happens is, even if you do an excellent orthodontic treatment, it takes 1.5 to 2 years. So it is very rare that patients usually say, wow, this is wonderful transformation to you. So mostly after removal of the orthodontic appliance, the primary expression of the patient is of relief. So a sudden transformation will make the patient say, wow. That is the importance of bleaching. And again, you can give the option to the patient. If the patient is willing, the patient likes the whitening part, you can give the option to the patient that you can continue with your bleaching procedure, or if the patient doesn't want to, you can always stop with this particular step and charge accordingly. So how to do this, we'll discuss later. So this is how you can, one of the many examples how you can incorporate bleaching in your practice. And this is another case. This is another case where I've debonded. This is the situation, and I've done a small step of whitening, and I've done some aesthetic recontouring, and I'll give the option of bleaching to the patient after this. So you can see that's a small change. Again, as I told you earlier, at least 15 times more we can do. Now, an important question is, when do we avoid bleaching? So bleaching is contraindicated in cases where bleaching agents tend to become very close to the pulp very soon. So if there is chance of bleaching agent coming in contact with the pulp prematurely, there might be severe pain, and it might be bordering severe pulpitis-like symptoms. So such cases are when there are severe malformations of the tooth. The shape of the tooth is not correct, and some cases where there are deep cracks or very deep caries, which is very close to the pulp. And in very young patients where the bulb chamber is very large, and even if you apply bleaching agent onto the surface of the enamel, there is a possibility that it will come very close to the pulp. So in such cases, and in cases where patients having very unrealistic expectations and patients who are not cooperative, you can avoid bleaching. And in cases where you are already doing an orthodontic treatment, or you are planning a restoration and the caries is very deep, so a pulpal protection is required. In such cases, you can actually complete your restoration and then go for bleaching. And more specifically, you should be very concerned about the gingival health. because if you do bleaching procedure in a patient with a very inflamed gingiva, you will be in trouble. You might have sensitivity like issues. So always correct the gingival pathology first, then go on to the actual bleaching procedure. Another question is, why don't you bleach regularly in your clinic? I know that's maybe even less than 1% of the dental clinics in Kerala or the dentists in Kerala actually perform a procedure called teeth whitening. So whenever I've done my webinars, lectures, I've done a lot of interaction with several dentists to address their concerns primarily. So the two most important thing that I've got as a feedback is two things uh, they are worried about is that they think that the bleaching procedure is very complicated and it requires a lot of expensive equipment. And the second is they are really terrified about something called sensitivity. So we'll discuss all these in detail. But before that, we need to understand what the chemistry of bleaching is all about. So I'll try to make it very simple for you. The most important compound or the molecule that we use for bleaching is hydrogen peroxide. As we all know, hydrogen peroxide dissociates and form free radicals. And these free radicals actually cause bleaching. The other molecule that we commonly use, or the chemical that we commonly use, is carbamide peroxide. Now, carbamide peroxide, when it comes in contact with moisture, in the mouth it is saliva, it splits into hydrogen peroxide and urea. Now, hydrogen peroxide is again the active ingredient in carbamide peroxide, and urea will act as a substance to control the pH in the mouth. Now, if you examine the equation very carefully, you will understand that carbamide peroxide is nothing but sustained release hydrogen peroxide. So by now you might have guessed that carbamide peroxide is used when you need a sustained release of hydrogen peroxide, that is in home bleaching, whereas hydrogen peroxide per se is used in office bleaching. Now, from 100% carbamide peroxide, the availability is 30% H2O2. That means if you are using 10% carbamide peroxide, you are actually using only 3% H2O2. This is significant because in most of the commercially available packs, the percentage will be written of carbamide peroxide. So it will be 10% means this 10% carbamide peroxide for home bleaches. So you have to deduct, you have to understand what the amount of hydrogen peroxide is. Because in office bleach, the normal concentration is around 35 to 40% of H2O2. And you should understand that in home bleaching, it is somewhere around 3 to maybe 7-8% hydrogen peroxide is a normal norm. And from the equation earlier, I told you that it is sustained release hydrogen peroxide. That means the release of free radicals also is in a sustained manner. For H2O2 in office bleaching, the peak is very fast. It releases free radicals very fast. In half an hour, it will peak and go down suddenly. Whereas if you use carbamide peroxide, since the hydrogen peroxide release is very slow, the release of free radicals also will be very slow. It will take around 2 hours for the amount of free radicals to peak. Then it will form a plateau for a long time. It will form a plateau for a long time. And after some time, it will go down, depending upon the duration of the chemical that is required. Now, the third compound or the molecule that we commonly used to use is sodium perborate. We don't use it anymore because we have better materials, better product available for walking bleach that we will discuss later. So nowadays we use only two materials, that is hydrogen peroxide and carbamide peroxide. Now coming back to the free radicals, how does free radicals cause teeth whitening? The most important of free radicals are perhydroxyl free radicals and hydroxyl free radicals. Now what these do is they act on long chain molecules called chromophores. Chromophores are actually organic molecules which are very highly cross-linked. There is a lot of double and triple bonds which are interconnecting all the small chains in the molecule. So this will result in a very densely condensed large chain molecule which will not allow light to pass through and thus cause slight discoloration of the tooth. Now what these free radicals do is they actually attach to these chromophores, slowly convert all the triple bonds into double bonds and double bonds into single bonds. Now, what happens is from a highly cross-linked molecule, this will convert itself to a long chain molecule. So since it is now a long chain molecule, there is no cross-linking. It will allow more light to pass through it, and hence you get more pronounced brightening of the tooth or change in value of the tooth, which will manifest as teeth whitening. Now, one of the characteristics of hydrogen peroxide is that it has very low molecular weight. Now, hydrogen peroxide can very easily enter enamel because of the low molecular weight, and it will enter the DEJ and suddenly cross to the dentine and spread inside the dentine and slowly convert the chromophores into long chain single molecules and cause bleaching. This is the effect that we are looking for. Now that explains how does bleaching occur. Now we'll go on to the classification of bleaching. In the textbooks, you will normally find these classifications. The tooth whitening is divided into vital bleaching and non-vital bleaching. But however, from a clinician's point of view, we'll try to make it a little more simple. We'll discuss in office bleaching and home bleaching techniques. So bleaching will be divided into office bleaching and home bleaching that I told you earlier. And for office bleaching and for home bleaching, there are vital and non-vital tooth techniques. Now, how to prepare a patient for bleaching? Firstly, you have to educate the patient. You have to inform him about the procedure and get an informed consent. And your diagnosis and other treatment planning should be very thorough. You need to do any other dental treatments that is required. And finally, when all the other restorative procedures or other procedures are complete, you will do a thorough oral prophylaxis just before bleaching and a polishing. After this, the next procedure is called photo documentation, where you take a photograph with the shade tab. The shade tab has to be arranged in the order of value like this. You can always Google it, just type arrangement of shade tab with the order of value. You will get this sequence of shades. And then you take a photograph with the shade tab. Now, this order is important because the number of shades lightening is usually calculated by the change in value of the tooth. Means if you are getting A1 from A3, you started with A3, then you're getting A1, means there is 7 shades of lightening occurring. It is not like A3, A2, A1. It's not 2 shades, it is 7 shades of whitening. If you start from A3 and finish with D2, it is 5 shades of whitening. So you calculate it in that way only. Now, this is how you do your photo documentation. You take a photograph like this with the shade tab in place. Now, this is for your future reference and for your reference when you are communicating with the patient in a later stage, so that you can describe and you can show him or her how much change has occurred. Now, once the photo documentation is complete, you can start with the bleaching procedure. Now, let's discuss office bleach first. Office bleach, you have 2 good products here in India. One is your Opalescence Boost, that is 40% H2O2. That is from Ultradent. And Pola Office Plus, that is 35% H2O2 from SDI, a company called SDI. Now, Opalescence Boost and for SDI, the biggest advantage is that they are only chemically activated. That means there is no requirement of any bleaching light. Now, that is a big advantage for us in our clinical practice. Now, this is Opalescence Boost. It has the highest concentration of hydrogen peroxide in the market, that is 40% hydrogen peroxide. Then there is the Pola Office Plus. Pola Office Plus is from SDI. It has 35% H2O2. The third product is Pola Office. It is better not to use Pola Office because Pola Office is powder liquid in form, so that when you need to mix it, you have to mix powder and liquid. And if there is any mistake in the ratio, you will have difficulty in getting a good result. So always avoid Pola Office. If you want to use Pola, it is better to use Pola Office Plus. Now, coming to the technique of office bleaching. First, what you need to do is you need to protect the gingiva, because bleaching agent is an oxidizing agent. It is a very potent oxidizer. So if it comes in contact with soft tissue like gingiva or the cheeks or the lips, it will cause an oxidation burn there. So first step is to protect the gingiva as well as the patient's eye and the operator's eye. So always use a protective eyewear. Then make sure that you have made a very good gingival barrier. The material usually used is available with the kit. It is a light cured resin, light cured flowable resin, which is usually colored so that you can identify it easily. You apply it over the gingiva and cure it with your light curing agent. Now, the gingival barrier is usually placed around 1.5 to 2 millimeters thick, and from the margin towards the sulcus, it is around 4 to 6 millimeters in length. First, you should place the gingival barrier inside the gingival sulcus, because if you don't place it inside the gingival sulcus, what happens is there is some seepage of clavicular fluid and it will seep through the gingival barrier and come in contact with the bleaching gel. So when it comes in contact with the bleaching gel, what happens is it can suck in the bleaching agent through capillary action, and this will result in the bleaching agent coming in contact with the gingiva, and it will precipitate symptoms which are very similar to sensitivity. So that you might confuse with sensitivity and you will have to stop the procedure. Now I'll show you a small video on bleaching procedure. Give me a second.
Before beginning the procedure, bring opalescence boost to room temperature. Determine the patient's initial shape with a beta shape guide for your records. Both the patient and the dental professional should use protective eyewear throughout the procedure. For added security, dilate the dental floss to one of the holes in the isoprop to prevent accidental swallowing. Place a self-supporting lip and cheek retractor, followed by the alternate isoprop. Instruct the patient to hold the isoprop in place with gentle but firm biting pressure. Completely rinse and air dry the teeth. Now you're ready to place the resin barrier. Start by removing the lower lip cap from the upper membrane syringe and securely attach a micro 20 gauge tip. Verify flow prior to placing intraorally. Then express continuously on upper band green along the gingival margin, overlapping approximately 0.5 millimeters onto the enamel. Extend the resin one tooth beyond the last tooth to be bleached, and continue building the barrier apically until it is 4 to 6 millimeters high and 1.5 to 2 millimeters thick. Check for all gingival tissues of the resin margin are covered and that a good seal is established. Using the mouth barrier, look at the right axis of the teeth and reapply the resin to any minute movements. Wait for the resin for 20 seconds to arch using a scanning nozzle. Carefully check the resin cure with an instrument. With the barrier cured, you're ready to apply libressus host to the prepared teeth. If libressus host is still correct, it needs to be mixed just prior to placement. The right plunger is securely attached to the clear plunger. Depress the right plunger, forcing the contents of the right syringe into the clear syringe. And forcefully depress the small clear plunger into the middle small clear syringe to rupture the internal membrane. Doing this combines the bleach and activator. Continue depressing the clear plunger so all of the gel is in the right syringe. Reverse the action and mix a minimum of 50 times stronger or 25 times on each side. Be sure to finish with all the mixed gel in the right syringe. Twist to separate the two syringes. Discard the clear empty syringe and attach the micro 20 gauge FX set onto the right syringe. If you feel any resistance, do not proceed. Attach a new tip and test the flow again before applying the process to the tip. opalescent spokes approximately 1 millimeter thick on the radial surface of the teeth to the incisor and occlusal surfaces. Allow the gel to remain on the teeth for 20 minutes, periodically checking and reapplying the gel to areas that have thin or need replenishing. Remove the gel using suction only. To prevent opalescent spokes from spreading onto the soft tissues, do not use round to rinse and initial suction. Suction the gel from the teeth using a lower back and surgical suction tape. Use caution not to dislodge the isolation barrier. Suction periodically with water. Evaluate the shape change after each application and monitor the patient for any sensitivity issues. Repeat application one more time or until the desired results are achieved. Do not exceed 3 applications per visit. The gel from the teeth using the lower back and surgical suction tape, and thoroughly rinse teeth with an air water spray and the high volume suction. Once the desired shade of white is achieved, use a dental instrument to remove the cured rubber band residue. You will easily come out in one or more large pieces. The total procedure, including setup and isolation, typically lasts 60 minutes. This includes 2 20-minute applications of opalescent spokes for a total of 30 minutes of whitening time.
Now coming back to the bleaching procedure, as you've seen in the video, first you apply a gingival barrier, which is around 4 to 6 millimeter in height to protect the gingiva. Then you apply a thin layer, say 0.5 to 0.5 to 1 mm thickness of opalescence boost, which is in a gel form. You apply opalescence boost over the teeth from usually first molar to first molar, and the application is for 20 minutes. So one application is for 20 minutes and a maximum of 3 applications is allowed in a visit. This is called one session. So one session will have 3 20 minutes application. Now, if you want further, if you want one more session, you can have maximum of 2 sessions, but you have to leave a gap of 1 week in between so that you not have any sensitivity issues. So it is 20 minutes into 3, that is one session, followed by 1 week rest, then 20 minutes into 3, that is the second session. Or you can start with one session of the office bleach and combine it with a home bleach. Now this is in one case where we had started with A3. We had done office bleaching using the opalescence boost, and a final shade is D2. So we have got a 5-shade whitening here from A3 to D2. This is another case where I have done bleaching only for 5 minutes, if I remember, 5 minutes of office bleaching, so that I could remove all the stains in this case. This is after just 5 minutes. You can see some of the opaque spots. Some of them are due to dehydration of the teeth, which will automatically correct itself when there is some rehydration occurring. Now, after rehydration, this is the situation after rehydration. Then I have done a procedure called resin infiltration. Resin infiltration is a very non-invasive procedure. So within 2 appointments, I have achieved this. And this is just what the patient requires. Patient doesn't require any this is an aged patient, so the patient did not require any fancy aesthetic correction. Only what the patient required I have done, and just in 2 appointments, that too, even without touching an aerotope. So this is 2 appointment magic, if you ask me. One appointment for teeth whitening and the second for resin infiltration. This is the pre-op and this is the post-op. Now, coming to home bleaching. Home bleaching, similarly, we have 2 good products. One is the opalescence series from Ultradent and the Pola from SDI. Pola has 2 products. One is the Pola Day, shorter wearing time, and the Pola Night. And the second is opalescence from Ultradent. Opalescence has 2 types. There is opalescence PF, which is the traditional bleaching method where you take an impression, make a bleaching tray, and then do the bleaching procedure. The other is the opalescence go. Opalescence go, the advantage is that you don't require a bleaching tray. You get the material along with a stock bleaching tray. Now coming to opalescence PF. Opalescence PF is the P stands for potassium nitrate, which is the desensitizing agent, and F is for fluoride for remineralizing the teeth. So it already has desensitizing compounds already incorporated into the bleaching gel. So that is one big advantage. The second is that opalescence PF has high water content at around 20%. So this high water content helps in preventing a lot of dehydration, which is otherwise occurs due to the long wearing time. Opalescence PF comes in several percentages, 10, 15, 20, and 35. These are all percentages of carbamide peroxide. These are not percentage of H2O2. This is carbamide peroxide. That means roughly it is 3%, 5, 8, and 12% H2O2. And the wearing time will also vary accordingly. So my personal preferences, I usually like to use the 10% PF because the wearing time is usually 8 hours, because that is the sleeping time of a patient. So it will be comfortable to most patients, because otherwise the patient will have to wear for a shorter time, 4 hours, 6 hours, means the patient will have to wear it during day, which is not feasible for some of them, or the patient will have to interrupt their sleep and put a timer and get up and remove the tray. So that is not very convenient. So my personal choice is always 10%. Again, it depends upon the clinician and the patient. Now, technique of opalescence PF. Opalescence PF, you need to first take a good impression and make a good bleaching tray. What you need to be very specific about is to get a very good beading or a rim lock on the bleeding tray, so that on the bleaching tray, sorry, so that the bleaching agent does not come in contact, does not leach through the tray and come in contact with the gingiva. So that is very important. So when you send it to a lab, make sure that you get a good bleaching tray. Now, once the bleaching tray is ready, you give it to the patient. You ask the patient to apply the gel from the mid of the label surface, from the middle of the label surface, from one molar all the way through the other molar. Then the patient has to place it onto the mouth and wear for the correct or the appropriate time. I'll show you a small video on home bleaching also.
Transfer your patient, use the provided patient instructions to advise the patient on the bleaching procedure, tray cleaning, tray loading, application of opalescence, and tray care. Explain the recommended treatment regimen to the patient. Show them how to load the tray by expressing one continuous bead of tray.
The audio is not clear.
Cycle edge on the facial side of the tray from lower to bottom. This should use about 1/2 to 1/3 of the sponge. Instruct the patient to place the tray over the teeth and gently press the tray to move the gel into place. Ask them to gently wipe off excess gel with a toothbrush or a clean loose finger. The patient should leave the tray in for the period of time recommended by their dentist. After the recommended time, help them remove the tray from their mouth and brush their teeth to remove all gel from the teeth. Show them how to clean the tray with a soft brush and full tap rubber.
Sir, audio is not clear in videos.
That is the maximum I can get for you. Now coming back to opalescence PF. Now one opalescence PF kit is around 8 syringes. That means 4 for the upper and 4 for lower, 4 for upper teeth and 4 for lower teeth. Now one syringe will give you 3.5 applications. One syringe will give you 3.5 applications. That means 4 syringes for upper means we'll have 4 into 3.5, 14 or 2 weeks, 14 days or 2 weeks for upper, and similarly 2 weeks for lower arch. Now, one syringe is 3.5 days, 4 syringes means 14 days or 2 weeks. So in a kit with 8 syringes, 4 will be for upper and 4 will be for lower. So you can do 2 weeks for upper and you can do 2 weeks for lower. Now, if you can listen very carefully, you don't usually give Opalescence PF kit to the patients. That will be a terrible thing to do, because one is the patient will immediately go home, he'll see the packet, see the product and try to Google it. What will come up will be the price of the product. So the patient will sometimes come and give it back to you and purchase it online, and you lose your goodwill also. The second thing is, it is very difficult to monitor the patient if you are giving all 8 syringes together. It is very difficult to judge whether the patient is using it or the patient is very lazy to use it. We can't be sure. So you always give only 1 syringe or 2 syringes to the patient. That is very important. Now, there is a protocol by which you can use Opalescence PF. So I'll explain it to you in detail. The most common way to use it is give 1 syringe to the patient. 1 syringe to the patient, do upper only first. Now, when you compare with office bleaching, since home bleaching is a slow method where only a small percentage of changes occur daily, the patient will not immediately appreciate the change if you do it both upper and lower arch together. So you already keep your lower arch as a reference and you start with only the upper arch. So in that case, you give only 1 syringe to the patient. So every 3 days, you recall the patient for 2 weeks and you check the progress of the case. And after the upper arch is complete, then you start with the lower arch. Again, give 1 syringe to the patient. So this will take 2 weeks for the upper and 2 weeks for the lower. So this is one protocol where it will take 1 month for the application to be complete. Now, in some cases where there is no time or you trust the patient, then you can do upper and lower together. That means you give 2 syringes to the patient. So within 2 weeks, you can complete your the first session of Opalescence PF. So 2 weeks is one protocol, 1 month is one protocol. There is another method where if you want to continue Opalescence PF after 1 session, if you want to go for the next kit also, because the patient wants a very extremely good result, then you can give another packet of Opalescence PF. But this time, since it is a very slow method, there is no need to give a gap of 1 week. Unlike the Opalescence boost, you can you can continuously do for 2 sessions. That means 2 weeks for upper, 2 weeks for lower, followed by again 2 weeks for upper and 2 weeks for lower. So this protocol will take you 8 weeks. So I have explained 2 weeks, I have explained 4 weeks, and the last one is 8 weeks. Now, I'll give you one more protocol for 6 weeks. If you start with 2 weeks upper, then go for 2 weeks lower. That means your patient has already understood the result. Patient will be a little more compliant, and patient also will feel a little more motivated. Then you can do the second session if you want in 2 weeks, upper and lower together. That means it will take 6 weeks. So these are the 4 protocols: 2 weeks upper and lower together, 4 weeks upper, 2 weeks lower, 2 weeks, 6 weeks upper, 2 weeks lower, 2 weeks, upper and lower together, 2 weeks, and finally 8 weeks, upper 2 weeks, lower 2 weeks, upper 2 weeks, again lower 2 weeks. So these are the 4 protocols that you can use for Opalescence PF. And coming to the price, how you do charge a patient? Opalescence boost will cost you on either side of 3,500. I'm not sure about the price. It is around 3,500. And you can charge accordingly. The important thing to note is that the patient will take around 1 hour to 1 hour 15 minutes of your chair side time. Now, Opalescence PF, the product will cost you around 6,000, somewhere on the other side of 6,000. Plus, you will have to incur the cost of bleaching tray, which will again come close to 1,000 rupees, plus or minus. So the rough cost will be around 7,000 to 7,500 rupees. Again, you can charge accordingly. The advantage is that the patient will take very less chair side time from your side. So these are two methods. Now coming to the third method, which is Opalescence Go. Here, as I told you earlier, you need not use, need to make a bleaching tray by taking an impression. The Opalescence Go material comes with a preloaded tray, which is customizable inside the mouth. Now that is a very simple method now. You need not even take an impression. The available concentration is 6, 10, and 15. What you need to note is that 6, 10, and 15 is not carbamide peroxide. 6, 10, and 15 is hydrogen peroxide. So the concentration is more, and consequently the wear time is little more less when compared to Opalescence PF. Now one packet of Opalescence Go, you'll have 10 trays. So Opalescence PF was 14 days. For Opalescence Go, the time is also reduced to 10 days, and the wearing time is also significantly reduced. Now one packet, I told you there are 10 packets. One packet will have upper and lower together. So what you need to do is you give one packet to the patient. The patient has to remove the outer layer from the packet, take out the tray. The tray will have two trays. It will be an outer green tray and an inner transparent white tray. The patient has to place the tray inside the mouth and gently suck or create a vacuum inside the mouth, or make a loud kissing sound so that there is some vacuum inside the mouth. So during this procedure, what happens is the inner tray will automatically mold itself to the shape of the tooth. Now you can remove the outer green tray, and the inner tray will remain inside the mouth. And continue this with the lower also, and wear for the appropriate time. So this is the procedure for Opalescence Go. I'll show you a video. I apologize for the quality of sound if there is any problem, because there is nothing much I can do.
Using Opalescence Go. Opalescence Go involves 4 simple steps. Remove Opalescence Go from the package. Center the tray on the upper or lower arch. Follow to secure the tray on the teeth. Once the tray is secure, remove the cover down tray and swallow it later. Opalescence Go features a 6% and should be run once a day for 60 to 90 minutes. During the 60 minutes with a 10%.
Now that is regarding Opalescence Go. So the procedure is a little more simple because you need not take an impression also. And the number of days are also reduced. The cost of Opalescence Go is around 7,500 for 10 days, 10 trays, I think. So each tray will cost you somewhere around 750 rupees. So you can charge the patient accordingly. Now, I told you earlier in my presentation about how to use bleaching in orthodontic procedures. Even without taking an impression, we can't, without debonding, we can't take an impression to make a bleaching tray. So what we do is, once you are completing the orthodontic treatment, you remove or debond all the orthodontic appliance. Then you do an oral prophylaxis. Then you give one tray of Opalescence Go to the patient. Give one tray to the patient. Ask the patient to wear it and wait in the waiting room for 30 to 40 minutes according to the wearing time. And then after that, remove the tray, ask the patient to clean the mouth, and then evaluate. So this is one method where with least investment and with least preparation, you can actually give a sample of bleaching procedure to the patient. So this will help you in your practice. Now, operations go, one session is 10 days. You can do maximum of 2 sessions without any break in between. And sometimes we combine bleaching. That is, one is to save some time. You do one session in office, one session in home. That will save a lot of time. And second is to cut down the cost, because office bleaching should be a little more cheaper. So that is the second reason we combine bleaching techniques. So in such cases, you start with office bleach. Instead of 1 week, you can give a 3-day gap. Then you start with the office bleaching technique. So that is another good way, and you will get very, very good results also. And now this is one case. We started with A4. We started with A4, and this is the final result. This is A1. So you can see, and this is after complete rehydration after a few days. Now this is A4. The final result is A1. So you start from A4 to A1 means it is 13 shades of white. That is a very good result, and the patient is also very happy. Now coming to some other important aspects. When to do a composite restoration or a bonded procedure after bleaching. Bonded procedure means it might be inlay, an onlay, a veneer, or a Emax crown, where you bond the restoration onto the tooth, or a composite restoration. So in such cases, wait for at least 2 to 3 weeks after bleaching, because one, you want the color to stabilize. There is always some 10 to 20% relapse that occurs after bleaching. So you want the color to stabilize properly. Then you know the final shade. Second is during bleaching, there is a lot of free radical and nascent oxygen production. So that will hamper good bond strength between the restoration and the tooth. So in such cases, wait for all the oxygen to be removed from the tooth and then go on to the bleaching procedure. Another important question that most of the dentists have, or most of the patients have, is how long will the bleaching result last? That is again depending upon the need of the patient. A bleaching procedure will not give you a lifelong result, but you can always manage with something called touch-up bleach. Again, the need of touch-up bleach should be explained in advance to the patient when you do a bleaching procedure. And you should also understand that different patients have different needs. So one patient might be coming to you for a bleaching procedure for his or her wedding. Usually such patients don't come up for review, and they are not usually interested in maintaining it for a long time. They forget it after the wedding. Then there are patients who want to have a sustained level of bleaching, but they don't want it to be full white always. They are not that into bleaching, but they require a reasonably good appearance. So for such patients, you can actually advise touch-up bleaches every once in a year. If you already have a bleaching tray made, you can give one opalescence PF syringe to the patient. Then they can use it for upper and lower. They can do it for 1 day or maximum 2 days. Or you can give an opalescence go packet to the patient for touch-up bleach. But if your patient is very much into aesthetics, or if she is a film actor or an actress or in the glamour field, and they require same level of teeth whitening to be maintained always, then they can do touch-up bleach every 6 months, or maybe even every 3 months with just 1 day bleaching. So that is also again depending upon the need of the patient, but a certain extent of relapse will occur, and you will have to manage, and you can manage very easily also with touch-up bleaches. And how does the bleaching procedure create an impact in your aesthetic practice? Now, this case came to me for midline diastema closure. And this girl, she was having a wedding in a month. So she was not at all interested in treatment. She was very reluctant to do even diastema closure, but her mother had brought her for the treatment. And I knew immediately when I saw this case that this requires bleaching, but I did not tell the patient because the patient was not at all motivated. Then during the procedure for composite restoration, this is the final result. This is with bleaching. And during the procedure for composite restoration, when I put a rubber dam on, her mother seemed to notice how unaesthetic her teeth were, how rough, how stained her teeth were. Then I took a photograph and showed it to the patient. And she also reluctantly agreed that it required some correction. So they asked me whether the bleaching can be done. So since they approached me rather than me telling them, I agreed to do bleaching. So again, this is after the bleaching procedure, and after a few days, once it has been rehydrated, then I continued with my composite restoration. Once again, put a rubber dam, and finally completed my procedure. And you can see how different it looks, and the impact of teeth whitening in the procedure. So this is how you can use teeth whitening to actually help you enhance the result of your treatment. Now, after bleaching, what are the post-operative instructions that you give a patient? For home bleaching, since it is not a very high concentration of H2O2, it is a very slow, mild form of bleaching. You can always tell the patient to avoid hot and cold food for the duration of the procedure. That is the only instructions required. And for home, and for office bleaching, what you tell the patient is to avoid any food for next 2 to 3 hours, and avoid very hot and very cold food for at least 24 hours. The second thing is you ask the patient to keep the tooth or the teeth moist with saliva, because some part of the sensitivity which might occur is due to the fact that the tooth is becoming severely dehydrated by bleaching. So you ask the patient to keep the tooth wet, keep the tooth wet with the tip of your tongue. So that way it will help in rehydration and to an extent reduce sensitivity if it occurs. Also avoid any colored food for a week, at least a week, especially food which is ordered from a restaurant, because it will have a lot of coloring in it. And also Indian spices are also not suited for patients immediate after bleaching. So avoid any colored food, black top, very dark coffee, and restaurant food for at least 1 week. And also inform the patient to contact you if there is any severe discomfort. Now that is the end of office bleaching. So that is the end of vital bleaching. Now, when you consider non-vital bleaching, this is the textbook classification for non-vital bleaching. We don't do power bleaches anymore. We have only 2 methods now: walking bleach and in-out bleach, or the inside-outside bleach. And we don't usually do the inside-outside also nowadays, because we have an excellent product for doing walking bleach that will give you the best result. The only thing you have to be careful while doing a bleaching is to avoid cervical resorption in case of non-vital teeth. This is for non-vital teeth only. When you do non-vital bleaching, there is a high chance of cervical resorption occurring if your bleaching agent comes in contact with the periodontium. You might have learned in oral pathology, oral histology, where there are some cases where there is a gap junction between enamel and cementum. Now, in such cases, the dentinal tubule is directly in contact with the periodontium or the bone. And if you place any bleaching agent, hydrogen peroxide, inside the pulp chamber, there is a very high chance that this bleaching agent will leach through the dentinal tubules and reach the periodontal ligament, where it will cause inflammatory reaction and result in tooth resorption. That is a very serious complication. The whole of the bleaching protocols that we will discuss today, the only thing you have to be careful about is regarding prevention of cervical root resorption, and that is the only technique sensitive procedure in all of bleaching. So that is very critical, and be careful about it. So in order to avoid this undesirable problem, what you do is you place something called a cervical barrier. The best material is to use GIC, glass ionomer cement. So once the obturation is complete, after doing endodontic treatment, you cut the gutta bursa at the level of gingival orifice, condense it, then place a glass ionomer cement and form a cervical barrier such that, this is important, such that the gingival, sorry, the cervical barrier always is slightly more coronal to the level of the bone. So the GIC has to be slightly more than the level of the bone, so that the particular area of genital tubules are covered properly. So this will help in avoiding the leaching of bleaching agent into the dentinal tubules and into the periodontium. So you do a probing, you to probe the height of the bone, then you probe inside the pulp chamber to the glass ionomer cement and make sure that glass ionomer cement is more coronal than the level of the pulp. Now, once that is finished, next you can proceed to the bleaching procedure. If you are doing an inside-outside bleaching, now this can be done in both ways. It can be done using a office technique or a home technique. In office technique, what you do is, once the cervical barrier is done using glass enamel cement, you apply the bleaching gel inside the cavity and over the labial surface of the tooth. So you are simultaneously applying inside and outside the tooth. That is why it is called inside-outside bleaching. So you can use a opalescence PF or the Pola for the Pola office for the procedure, if you are using it for office bleaching technique. This method can be also used to do a home bleaching procedure, but that is slightly difficult for the patient to do. What you do is you make a bleaching tray, then you give the bleaching tray to the patient, and after placing the cervical barrier using GIC, you place a piece of cotton inside the pulp chamber. Once the patient reaches home, what they do is they remove the cotton pellets, place the bleaching gel inside the tray and keep it onto the mouth. So simultaneously, the bleaching gel will enter inside the bleaching tray, inside the pulp chamber, sorry, and also on the labial surface. So again, simultaneously inside-outside bleaching occurs. But these two methods are not used nowadays, especially the home bleach technique is not used because it is slightly difficult for the patient to do. Because even after the bleaching procedure, the patient has to rinse properly, again place a piece of cotton inside the pulp chamber. So that is a little difficult for the patient. Now these two cases, these cases were done using inside-outside technique. You can see there is a slight pink discoloration on tooth number 21 due to pulpal hemorrhage, and this is after bleaching. Now this case also I've done inside-outside bleaching. This is 1-1, it is discolored and requires restoration. So I decided to go for bleaching, then followed by a composite restoration. Now this is pre-op and this is after bleaching. You can see the cervical area of both. You can compare and you can see that bleaching has occurred very well. The discoloration on the middle part is because of the temporary restoration I have given. I forgot to take out the temporary restoration for the photograph. Otherwise, the whole tooth is bleached very well. And this is the final composite restoration. So I gave a good mimetic restoration after bleaching. And this is the pre-op and this is the post-op. Now coming to the more preferred method of using walking bleach. This is again an office bleaching technique. Once the cervical barrier is placed using glass ionomer cement, you inject a small drop of the bleaching gel. Now Altraden has a product called Opalescence Endo, which is a unique product and which is exclusively for endodontic or non-vital bleaching. So you give a cervical barrier, place a small drop of Opalescence Endo gel inside the pulp chamber. Then you apply a light cured resin modified GIC liner, then cure it. Now after 3 days, you recall the patient. After 3 days, you recall the patient, evaluate, and if it has to be a little more bleach, you wait for 1 more day, ask the patient to come on the 4th day, and then on the 5th day if required. 99.9% of the cases will complete bleaching in 5 days. Very rarely it will require more bleaching. In that case, you remove the bleaching agent, apply a new one, then ask the patient to come every day so that you can check and stop whenever it is required. The problem with opalescence endo, or the problem with walking bleach, is that if you don't stop it at the right time and when the shades are matching, then there is always a chance of over bleaching, and you cannot correct over bleaching. It is difficult to correct it. So make sure that the patient doesn't miss any appointments. This is one case. One there is severe discoloration, and this is after 5 days of bleaching. The second case, again there is discoloration, and we had planned to give a crown for this patient, but unfortunately the patient did not report to me on the 4th and 5th day. Patient missed the appointment and came to me on the 6th day. Now you can see that there is some sort of over bleaching occurring here. Fortunately, I had planned only for a crown, so I could easily manage. But if it was a composite restoration, or in a case where no restoration was required, then we'll be in trouble. Now this is after the restoration is complete. Then I give a crown, and this is the crown with all the characterizations. Now that we have discussed all the procedures, office bleach, home bleach for vital teeth, office and home techniques for non-vital teeth. Now, how to know when you have to stop bleaching, when the maximum bleaching has occurred? The correct method is to evaluate the color of the canine and the central incisor. Once the canine and the central incisor becomes one color, it means your central incisor can no more be bleached. So that is one scientific criteria where you decide when to stop bleaching. And also you should also consider the relation between a patient's skin color and the tooth color. All patients don't look very good in very white teeth. So there has to be a balance of aesthetics there. And it is a consensus that you and your patient should reach what color you are aiming to achieve. Now, by this time, you might have understood that the bleaching procedure is not very complicated and does not require any fancy equipments. So we'll come to the next reason, which is troubling most of the dentists, and they are very apprehensive to do bleaching. That is sensitivity. Now, you should understand that sensitivity can be both gingival and tooth related. Now, gingival sensitivity is not true sensitivity, but the symptoms will be very similar to tooth related. That I've already told you in the course of my presentation. It might occur due to gingival inflammation if there is no scalloping of the bleaching tray and the bleaching tray contacts gingiva for a long time, or in case of office bleaching, if you have not placed a very good gingival barrier, again the bleaching agent will come in close contact with the gingiva. So in such cases, if there is any sort of burn on the gingiva or in gingival inflammation, the antidote is to use a vitamin E capsule. If there is any burning anywhere, then you can use a vitamin E capsule. It is available in the form of an oil. The capsule, if you break the capsule, you can get vitamin E oil. You can apply it on the areas where there is any damage to the gingiva. It will heal very fast. So gingival sensitivity is not something you have to be worried about. Now coming to tooth-related sensitivity, the first thing that you should understand as a dentist is that tooth-related sensitivity, bleaching-related sensitivity is a transient form of sensitivity. It is not a type of sensitivity that you do bleaching and the patient will have sensitivity for his lifetime, struggle to manage it. So that is not the situation. The sensitivity is always transient, and it has nothing to do with the hypersensitivity that you usually see in the clinic, because hypersensitivity is explained by hydrodynamic theory and due to movement of the dentinal tubules. But bleaching related sensitivity is completely different. It is pulpal related and due to slight reversible pulpitis that is occurring in the pulp. So even in cases where you have very severe unmanageable sensitivity, it will completely go down in a week, maximum 1 week, and it will be manageable in 2 to 3 days. In 98% of your cases, maybe 99% of the cases, the sensitivity will last only a day or two, and it will be completely gone by maybe 3rd day, 4th day. That is the usual situation in the clinic. Now, how to manage sensitivity? Best, if you are anticipating sensitivity, the best method is to put the patient on a desensitizing toothpaste 2 weeks before bleaching, so that patients is adjusted to or desensitized to the procedure. The drug of choice to treat bleaching sensitivity is to use potassium nitrate. Now, potassium nitrate is the only drug that can cure bleaching related sensitivity as of now. All the other products that you use for sensitivity from all the companies that uses the hydrodynamic theory as its basic principle. So what potassium nitrate does is it is very similar to the hydrogen peroxide because it is low molecular weight compound. It easily enters the enamel, dentine, and subsequently the pulp, and it reverses whatever action the perhydroxyl radicals were causing, and it will reduce the inflammation. So this is how it acts. And the best material, I've tried Sensodyne K, I've tried Thermosilare. These are all having very low availability of potassium nitrate, I believe, because the patient, it was difficult to manage the patient with these space. So the best material is Ultra Ease from Ultradent. It is potassium nitrate in a gel form. So I always have Ultra Ease with me if I'm doing office bleaching. I give it to the patient only if it is required, only if the case requires, the patient has having sensitivity. Otherwise, I don't give it to the patient, but always keep one syringe with me. If the patient has already planned office or home bleaching after this office bleaching procedure, you can give Ultra Ease and ask the patient to apply it on the bleaching tray and keep it so that there is a lot of contact time with the gel. If there is no bleaching tray that has been made, then ask the patient to apply Ultra Ease directly onto the tooth using the fingers on the affected tooth only. So this is the best method to manage potassium tooth related sensitivity due to bleaching. So I hope you might have understood that the procedure bleaching is not very complicated, and sensitivity is actually not a big issue. It is transient sensitivity. You can easily manage it. And my endeavor in this lecture was to make you understand as a clinician in a clinical setup that bleaching is a very simple procedure, and it is safe and effective also. And I would like to thank IDA Central Kottayam for this opportunity, and all of you who are attending the webinar also. This is my family.
Excuse me, sir.
Yes.
Sir, what is the right time to install Zoom, Philips Zoom, to install in the clinic? What is your take about the Philips Zoom?
Zoom is an old concept.
Yes, sir.
Zoom is an old, outdated concept.
Sorry, sir.
Zoom is an old, outdated concept.
Okay, sir. Okay, you would say there is no need of taking so much an expensive material equipment in the clinic, and just the Ultradent will work.
What will happen with bleaching light is that I showed you cases where there is some sort of opacity on the teeth.
Yes,
there is
sir.
some sort of opacity on the teeth after bleaching. So that
Yes.
is due to dehydration. Now, what happens is when you do bleaching with lights, at least 50 to 60% of the whitening that you see immediately will be due to dehydration, due to the temperature of the light. So you might see a good whitening, but after 1 week it will go back very, the amount of whitening will be very less. So that is a problem with all the bleaching agents which require light, because along with light you get a lot of heat also. This heat will rehydrate. This will you will see, maybe you immediately after bleaching you might think you got an excellent result, but what happens is after 1 week, once the rehydration has set in, most of it will be relapsed. So a better method is without light, and the best method is home bleaching. It is not even office bleaching.
Oh. Best method is, sir, best method is?
Home bleaching. Home bleaching.
Home bleaching. Okay, sir. Sir, one more thing is
Let me
people
complete my
ask,
presentation, please.
patient asks, sir, how
Let me
durable it would
complete my
be.
presentation. I'll give time for you to ask the doubt. So this is my family, my two kids and my wife. They are very supportive. My wife is doing a post graduation in prosthodontics right now, and this is my clinic, Metropolis. It is in a place called Mangavu in Kozhikode, and I do my practice here. And I'm very passionate about my practice and on aesthetics also. This is my contact number, and if you are having any doubts regarding bleaching or any aesthetic procedure or endodontic procedure, you can always feel free to contact me. And I wish you all growth in your practice, especially in cosmetic dentistry. Thank you very much. I think you can. Someone was asking me something.
Yes, sir. Sometimes patient ask like a question that how long, how durable it would be. Then what should be our answer?
I've already told that in my lecture. You need to advise the patient that you'll have to do some touch-up bleaching. It depends upon the need of the patient. Touch-up bleaches will always be required.
Okay, sir. Thank you.
Any other doubts can be asked in the comment section or directly to the speaker. Any other doubts?
Tony Matthew is asking any particular type of suction. Ultradent has a micro suction, which makes it very convenient to use. It is not very expensive. I think it is around 100-150 rupees. You can attach it to your normal suction, and you can it will help you to suck directly from the tooth surface. So that is one option. The other option is to use a cotton pellet to wipe off the bleaching gel. The only thing that you need to be careful is to never use a three-way syringe directly to clean the tooth, because any splash of bleaching agent onto the skin of the patient or inside the mouth, that can lead to severe burns. So always remove the bleaching gel either with a suction or with a dry cotton pellet first, then clean the teeth with your three-way syringe. So one person is asking, when we do diastema correction or any aesthetic correction after bleaching, wouldn't the relapse of color affect the color of the composite? You are correct. So if you are planning any bleaching procedure on a patient who already has a composite or a crown, you should advise the patients that when you do bleaching, your teeth will become whiter, but your previous restorations and your prosthetics will remain the same in color. So you will have to replace, once the color is stabilized, you will have to replace all the restorations. In case the patient is already having a deep caries, you need to do a restoration first, followed by bleaching. Then what you do is you don't do a complete restoration. You do an interim restoration. Say if you are doing a class 5 with a deep cervical abrasion, then what you do is you do a selective etching bonding agent application, and you give a thick liner. That is all. Then after bleaching, after 2 weeks, then you remove the parts of the composite restoration and restore the case to the new color. That is how you approach. And regarding the person who asked the first thought was asking about Zoom. Zoom is a product which was, I think, developed by Philips. That at that time light was considered to be important, but there is this drawback of light. The same drawback is also seen with if you use any cheap bleaching agents. There are so many Indian and Chinese companies coming out with bleaching agents which are very cheap. The problem is chemically it is very difficult to manufacture a stable bleaching agent. So most of the companies will have a very acidic pH. Most of the cheap bleaching agents will have a very acidic pH, and this will result in a lot of dehydration when you do bleaching. So immediately after bleaching, you will get a very good result, but after a week or two, you will have a lot of relapse. Any other doubts?
So I hope we can wind up now. No other doubts, right? Yeah, ask.
Sir, I would like to ask one question. That a patient with history of trauma and he has some discoloration on teeth, but not willing to go for root canal. Can that internal stain be corrected without doing root veneer with bleach alone to some extent?
Maybe to some extent, but the cause, since you are not removing the cause, the underlying tooth structure, the stump will become darker in time. Since you are not doing any endodontic treatment, you're doing only a peripheral bleach. The bleach will not penetrate that much so that you get a good result. So there will be some whitening that is occurring. Maybe you can manage it with your veneer, but it will not be an aesthetic veneer because you will have to increase the amount of opacity. So even if you manage with the veneer, after 3 years, 4 years, 5 years, the underlying tooth, since you have not done root canal treatment, will keep on increasing in chroma, means it will keep on becoming more and more discolored. So eventually, it will become unaesthetic. So endodontic treatment will be a must in such cases, if there is an endodontic cause. I hope that answers your question.
Yes, sir. Thank you.
So Dr. Ashish, shall we?
Yeah, so we can wind up, right?
Yes.
So thank you, Dr. George Thomas, for this valuable time discussing the bleaching techniques and what all things and whichever methodology is fine for us and economical for us. Thank you for opening a new chapter and throwing a slide to the area. So I welcome Dr. Vishy. Sorry, actually, Dr. Sherry is not, his network is not actually getting properly. So, that we can go for the wind up section. I welcome Dr. Vishy for the vote of thanks. Dr. Vishy. Yeah.
Hi, Vishy. Vishy is actually my wife's batchmate.
Actually,
Yeah, he told me that.
For giving me an opportunity in this series. Like, let me first thank God Almighty for helping us, for blessing us with this wonderful series. ഇന്നിപ്പം ഞാൻ പാലാ ബ്രാഞ്ചിന്റെ ഇൻസ്റ്റലേഷൻ വെന്യൂവിലാണ്. അപ്പോൾ അതുകൊണ്ടാണ് ഈ വെന്യൂവിൽ നിന്നാണ് സംസാരിക്കുന്നത്. On behalf of ID CKK, I thank Dr. Jose Thomas for giving us a very wonderful CD on teeth whitening simplified. ഇനി ഞാൻ ഈ ഔപചാരികത എന്ന് വരികയാണ്. ജോസ് തോമസ് അഥവാ ജോസേട്ടൻ എന്ന് ഞങ്ങൾ വിളിക്കും. ഞങ്ങൾ മുമ്പ് പരിചയക്കാരാണ്. ഞങ്ങൾ കോട്ടയം BDS ഞാൻ പഠിക്കുമ്പം ജോസേട്ടൻ ട്രിവാൻഡ്രത്ത് BDS പഠിക്കുന്നു. ഞങ്ങളുടെ സീനിയർ ആയിരുന്നു. ഞങ്ങൾ ഇന്റർവെൻഷൻസിനൊക്കെ ഞങ്ങൾ കണ്ടുമുട്ടുകയും വളരെ നല്ല ഒരു സൗഹൃദം കൊണ്ട് ഒരു വ്യക്തിയായിരുന്നു. അതുപോലെ ജോസഫിന്റെ വൈഫ് ജേർണി എന്റെ ബാച്ച്മേറ്റ് ആണ്. അപ്പം വളരെ അടുത്ത ഒരു റിലേഷൻഷിപ്പ് മെയിൻറ്റെയിൻ ചെയ്യുന്ന ഒരു വ്യക്തിയാണ്. അപ്പൊ ജോസഫിനാണ് ഈ ഒരു ടോക്ക് വരുന്നത് പറയുമ്പോൾ ഭയങ്കര സന്തോഷമായിരുന്നു. പക്ഷെ ഇന്ന് ഈ ഇൻസ്റ്റലേഷൻ നടക്കുന്നത് എനിക്ക് മര്യാദയ്ക്ക് ഒരു പാർട്ടിസിപ്പേറ്റ് ചെയ്യാൻ പറ്റില്ല. പക്ഷെ മുന്നോട്ട് ഐ എം ലുക്കിംഗ് ഫോർവേഡ് ഫോർ മോർ ഓഫ്ലൈൻ സെഷൻസ് ഫ്രം യു. So I thank Dr. Joe Thomas on behalf of IDS CKK for giving us this wonderful CD. Thank you so much.
Thank you, Vishi. Thank you. Nice to see you.
Yeah. Next, I would like to thank Dr. Sherry, the Vice President of IDA Kerala State Branch. Because of this installation program at Pala, he couldn't actually attend this CD. Still, we are blessed to have his presence. So I thank Dr. Sherry for his all guidance. Next, I would like to thank Dr. Manoj Thomas, our president. He has always been very motivational for his leadership and mentorship. I thank Dr. Manoj Thomas for all the values he has been driving at. Next, I would like to thank each and every participant from our branch, from other branches, for this your participation and your keen enthusiasm. Once again, thanking you all for everything. Thank you so much.
So thank you everyone. We can wind up.